Good afternoon. Today we are going to discuss the COVID-19 pandemic which we are currently facing in the world today. So first, what is it? The COVID-19 virus is a respiratory disease that is spread from person to person. It is spread through the air by coughing and sneezing, by physical contact with other people, and by touching the nose, mouth, and eyes. The main symptoms are fever, cough, and shortness of breath. These are just the main symptoms and the most common, but they vary from case to case. And as more information is being found out about this virus, more symptoms are being shown in different people. Who is the most at risk? The elderly and those with immunocompromised bodies are the most at risk because the elderly have a weaker immune system. They are more susceptible to this disease. And for people who have other medical conditions such as diabetes, hypertension, cancer, HIV, and AIDS, they're more at risk for any kind of disease, especially for one that we don't know so much about and it's attacking the immune system specifically. So they are more at risk for these diseases. The prevention, the main key prevention that should be implemented daily, not just with a pandemic, is washing your hands. This goes for any disease process, any virus. It'll help prevent it and keep it at bay instead of spreading the way we've seen the coronavirus spread. Staying at home as much as possible, so only going out when you absolutely have to, and especially if you've been sick, if you've been around someone who's been sick, if you know you've been exposed to the coronavirus, or if you've had a fever in the past 24 hours, you need to stay home for at least 24 hours after you've been fever-free. Maintain a social distance of at least 6 feet, so when you do go out in public, not being right on top of people, not touching, not shaking hands, not hugging, but remaining at least 6 feet away from each other. Avoid touching your face and covering your cough or your sneeze. The treatment. Currently, there's no treatment approved by the FDA, so the prevention is key in preventing the spread of the COVID-19 virus. There are a number of medications that they have discussed being helpful, but they haven't officially stated that they are 100% helpful in this case. So right now, the prevention of the spread of disease, so self-isolating, quarantining, being away from people as much as possible is what's keeping this coronavirus at bay for as long as we can. Thank you for watching my video. I hope you learned a lot, and thank you.